Well, July is Sarcoma Awareness Month, and here to talk with us about that is Dr. Silvana Bucur with St. Luke's. Dr. Bucur, thank you so much for being here today.
Good to be here, thank you.
Well, first of all, just explain what is sarcoma?
Well, as you all are aware, any cell in our body can become cancerous. Sarcoma is the cancer of any soft tissue. It could be the cells from blood vessels, from nerves, from fatty tissue, from muscles, from bone that become cancerous.
How would you know? What are the symptoms that you might have that?
So symptoms are very difficult to explain. They're not specific for cancer, but specifically for sarcoma, you could have maybe a lump or a swelling, a painful swelling, bone fracture or bone pain. Those are, or even, for example, limited with motion of a specific joint.
Is it common?
Not really. Per year, it's estimated at about 13,000 cases of sarcoma. So it's not as common, for example, as breast cancer, or lung cancer, but it is a cancer that we usually deal with. About 1 in 340 or so patients will get sarcoma in their lifetime.
And is it more common in any certain population
No,
than others?
it's not. It's really distributed evenly between males and females. There are certain patient populations who have inherited syndromes and they're higher at risk. And those, of course, populations that are exposed to certain toxins that may increase their risk for sarcoma.
And you mentioned that there aren't like really specific symptoms for it. So how is it diagnosed? Is it a difficult diagnosis?
So first of all, the physician and the patient has to suspect something's going on. So if you have a lump or a pain that's unusual, that's unprovoked, you should bring it up to your primary care provider. And it could be that they may get an ultrasound, an X-ray, CT scan, a PET scan, whatever, an MRI, depending upon where the symptom lies.
And would you have to then do a biopsy as well?
Then you would have to do a biopsy. And generally, the treatment for sarcomas are what we call multidisciplinary, meaning there are multiple different subspecialties involved in the treatment. At the foundation is a surgical oncologist. Sometimes if it's the bone sarcoma, it will be an orthopedic oncologist. Radiation oncologists as well as medical oncologists are involved.
And so multidiscipline then, would that also then mean that there could be some chemotherapy or radiation involved as well, or other medications?
Well, surgery, radiation, and or chemotherapy all are potentially involved in the treatment of sarcomas.
So is there a cure for it, or is it more about a treatment for it to hopefully put it into remission or remove it?
Well, potentially if they're diagnosed early on, yes.
So this being Sarcoma Awareness Month, I guess, what would you encourage people to do to, either discuss, what they should watch out for themselves, or if they know someone in their family, what can they do to help them out?
Well, I think it's important to be aware that sarcomas are cancers and how they occur. And if there's any unusual physical finding or symptom, they should bring it to their primary care for further investigation.
Don't ignore it.
Don't ignore it. The earlier you diagnose it, the better chances that you survive it.
Boy, that goes with so many things, too,
Absolutely.
doesn't it? Just
Absolutely.
pay attention to your body. It'll usually let you know if something wrong is going on. Dr. Bucur, thank you so much for being here today.
You're welcome. Thank you.
During Sarcoma Awareness Month. Appreciate it.
Thank you.
And we'll be back with more of the news at 4.